Which of the following interventions should be performed as soon as possible after initiating appropriate IV antibiotic therapy? Okay, so this is like a medical management. 60-year-old man presents to ED with increasing pain and swelling in his right forearm after sustaining a minor scratch 3 days ago. He has fever and chills. On physical exam, the right forearm is erythematous, warm and tender with areas of dark purple discoloration, bullae and crepitus. Temp is 38.7, pulse is 105, respiratory rate 22, BP is 100/65. Lab results show white blood cell, so he has leukocytosis here, 20,000. Imaging studies reveal gas in the soft tissues, which following intervention should be performed as soon as possible. Okay. Minor scratch 3 days ago. He has this crepitus. He has leukocytosis. There's gas. They're going to do the proper, so it's probably something,
So
could be
what's
in
your
like that.
diagnosis here? Would you say?
So I'm thinking it's like one of the, could be like gangrenous or, I'm thinking which Clostridium species produces that gas. It's like you see those pictures of like the green bubbles on people's
Sure.
skin. I'm not sure if that's right. Um, Intervention performed as soon as possible. I mean, wound debridement and skin grafting. I mean, we've ordered a ton of those. We see a lot of that. I don't think you're gonna do surgical debridement because it's a minor scratch on his forearm. I don't think you're gonna amputate right away. I&D, I think, is somewhat appropriate, but I'm not sure. Because I don't know if there's like pus. I mean, there's gas. Hyperbaric oxygen therapy, I don't think that's like a next step. I think that's like a after certain things don't work. I think it's like a secondary step. But I don't know what skin grafting is. If it's like wound debridement and then like culture, maybe just to ensure. But usually with that, I'm thinking like osteo or something, osteomyelitis. So, yeah, I'm not sure if I mean, if you scratched it, I don't know why you would incision it more and then drain it. I'm not sure. I would probably do the debridement and grafting, but again, I'm not super confident.
Okay, let's talk about this one actually. So
Okay.
this patient, if you kind of look at it, right, even though it's a minor scratch, the issue
Hmm.
that you worry about is that he's kind of septic, right? He's tachycardic,
Okay.
he
Yes.
has hypotension, right? His forearm is
Leukocytosis
erythematous
too.
warm, right? Tender, right? Bullae
Hmm.
and crepitus. Crepitus means there's gas under there. Anytime you see gas, you got to be thinking necrotizing fasciitis.
Okay.
Okay, which is horrible, right? Necrotizing fasciitis is absolutely horrible. So anytime you're thinking necrotizing fasciitis anywhere in the body, you got to go back to the OR, open everything up, and debride, meaning you take all the tissue that is dead, infected, and nasty.
Okay.
Okay,
Okay.
because even though it's just a scratch, but if that bacteria has spread along that fascial plane, you got to take them back. You got to kind of explore it, debride it, irrigate it with antibiotics, right?
Okay.
Open it up. If not, then this can spread rapidly, and patients can die pretty fast. But like you said, but
Okay.
most of the other logic is really good. Hyperbaric oxygen therapy can be used as an adjunct therapy after the
Down the
surgery.
line though, right? After
Yep.
like, okay. Okay.
Yep. Incision and drainage is usually for like a pus pocket, but you got to do an
Okay.
extensive debridement for anything that has crepitus and you're worried about necrotizing fasciitis. Limb
Okay.
amputation, right? If you can't get rid of it and you're
You
like,
might
oh my
have to.
God, like it's spreading, then you're like, okay, maybe I just have to cut it off, right? To save the body, right? But
Okay.
not your first line, like you said. Wound debridement, right? Which is good in itself, right? That's what you do in the surgery. But skin
Right.
grafting, meaning you take skin and place it over there, but you never want to place a graft on infected, nasty tissue,
That
So,
makes sense. Okay.
so yeah, definitely for sure, you're gonna want to replace that tissue. Yeah, you need everything to heal before you think about any kind of reconstruction.
Okay, so it's just debridement. So anytime I see crepitus, I should be thinking necrotizing fasciitis,
Yep.
and then you're gonna want to do surgical exploration and debridement. Like you said, you're gonna want to take like more tissue out than you would think in a way. Like at least for my thinking, right? It's like, yeah, you're gonna really want to scrape it out
Oh
as
yeah.
opposed to just like, oh, we're just gonna like do a light, debridement. It's just like, no, you're really getting it out.
Oh
Okay.
yeah. So
Okay.
practically, we also deal with necrotizing fasciitis of the neck, which is very painful because the neck
How does that happen?
uh there's a lot of things. For one, IV drug users.
Okay.
If they run out of
Tattoos, maybe like tattoo stuff or no?
not so much tattoos because you have to
Okay.
be pretty deep. Weird cuts, right? Like in dirty areas, right, of the neck can happen, right?
Okay.
Um, but yeah, so it's kind of funny how you were thinking about it because I'm funny in the fact of it's the classic presentation and kind of how people think it's like, oh, it's just a scratch, can't be that bad. And then when you
Right.
see air in there, you're like, oh crap, it's actually really freaking bad. You know what I mean?
Okay.
So
Okay.
so it looks on the outside, you're like, it looks on the outside of the skin, it's red, it's hurting, but you're like, oh, it's probably just like cellulitis or infection. But then when you see air bubbles like on the CT scan or imaging and you actually open the neck or open the arm or open stuff, dude, everything's like dead under there. It's like really nasty,
Oh,
right?
okay.
So clinically, it's a little bit misleading, like on a physical exam wise, because
Okay.
underneath it's just way worse. And so you
Okay.
always got to open it up, look, and then you find like we always call it like the grind, right? Like practically white dead tissue underneath. You got to take all that out. You practically got to
Okay.
cut all that tissue out until the so healthy tissue bleeds, right? So you
Okay.
practically have to cut it all out until it bleeds on the edges, irrigate the crap out of it, and then close it back up and see kind of how it works.
Okay.
But there's
Okay.
sometimes you have to go multiple times to take a look because you think you got it all and then more tissue dies. And so it's a pain in the butt. I mean, these bacteria are very, very aggressive for necrotizing
Okay.
fasciitis.
And you're usually thinking the Clostridium. I can't remember
Yep.
which one. Okay.
Clostridium perfringens is usually a good one,
Perfringus. That's what it
but
was. Okay.
also the strep species is also high on the differential too. Strep species can cause also neck fash too,
Okay.
like
Okay.
strep. I want to say strep pyogenes, but you might have to check. I think it's
No,
strep.
Pyogenes that sounds correct to me.
Yeah.
Pyogenes does that.